Are you looking for a podcast where you can hear from real people regarding their real dental drama? If so, then you've come to the right place. Join hosts Bethany Petty and Dr. Rena Kuba as we dive into the solutions we've created and the mistakes we've made while managing dental drama. Let's get started.
All right, so we get to do part 2 of a conversation that we started in last week's episode on should I sell my practice? And so for listeners, if you haven't gone and listened to that episode, I would highly encourage you to do that because we're going to jump right back into it today. I left last week talking about how in these moments when you've really thought about selling and we identified what stressed you out, we realized how much an associate has to do with you maintaining your practice ownership. So we talked about the stress of 100% of the responsibility falling on you for production, and that's stressful to you because you know you have all these employees that rely on you. We've talked about how you really don't want to be so tied to the practice that you have to be there every day, slaving it. You've got family situations that you need to be able to get away from the practice from. You like to have the ability to kind of bounce ideas off of other people, practice management, staff management, even punting some conversations to other people for your staff conversations. And then just the ability to have a very booming practice that has the ability to grow without it being 100% reliant upon you. So in all those conversations where it's like, this is what stresses me out about the practice, one of those key solutions was this reliance on an associate. So can you talk with us a little bit about that?
So I agree with everything you say about the benefit, all those things that you just mentioned. So to me, what I probably the thing I love most is just knowing that somebody else is there to have my back. Like even down to something as stupid as if I'm running a little bit late, it doesn't matter because the associate can help get things started for me. There's another body present. There's somebody present if I'm on vacation to help cover call. Mm-hmm. So that's super helpful. I think with all the things you were mentioning, like staffing issues or, can we treatment plan this together? What do you think? Or this mom is saying this, like, what do you think? Just sometimes we get in our zone and kind of, then your colleague will say, well, why can't you do this? Crap. I guess I can do that. I just wasn't thinking about that. So it's just kind of nice to have somebody to bounce off of, even down to like materials, hey, there's this new composite out. Should we do this? So I have really, really, I hate being there by myself now. And I'm not a people person, right? I'm an introvert. I'd rather not, I don't need another chum or another pal, but just to have somebody else in the office that, like you said, if there was a medical emergency, is there somebody else to help me take care of it? And again, not that an associate's going to be there all the time because we're not there. We probably overlap a day here and there. But just the peace of mind knowing that it's not all on me. The other thing that I don't know how true this is, but in my mind going, was it a little bit of passive income? Mm-hmm. And maybe I am making something off of it. Maybe I'm not, but at least the practice can still run. The patients can still have somebody, if I'm not there, then the practice is shut down. Mm-hmm. But at least somebody's there. So whether that money comes to my pocket or not, but at least we didn't lose the patient over it. At least we didn't lose staff over it that maybe wanted to work more days, but then couldn't if I wasn't there. So, anything else I'm missing that you've heard me say that I am forgetting right now?
No, I feel like you're hitting on all of the main things that that we've talked about. And I want to kind of frame it with this selling of the practice, because there is a value to the associate immediately, right? Oh, they help with decisions. They help, with all the things that you just mentioned. So we get kind of this immediate value. When we frame it with the topic, which is, should I sell my practice? It does a couple of things long-term as well that I think you and I have talked about, but we focused more on the immediate. So I'll cover a couple of those, which is you can quite obviously build a practice bigger with 2 providers as opposed to just one provider. Okay. So if we're like, man, I can't make it. I'm going to want to sell in, 5 years. If the numbers look right, I'm like, well, then let's blow this sucker up. Like, let's get this practice as big as possible. Because I'm thinking from an investment standpoint, we want to get the most out of that investment. As you know, we're in the middle of selling our house, and we've put all this work, all this money, all this time into making this house look a certain way, because we want when potential buyers are coming in, we want them to go, wow, this is a great investment. Look at how nice this kitchen is now, and blah, 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 blah. We do that because we want to get maximum dollar out of our house. We think about it the same way with a practice. Okay, if I know, man, I can only power through for the next 5 years, great. Blow that sucker up. You get it as big and as robust and as healthy as you possibly can. And an associate can be integral to that process, because there's only so far one provider can take it. Now, that doesn't have to mean, like you've said, practice owner and associate working side by side every single day. Your practice may not be able to sustain that. You build in what you can. So I've got one, she's not considering selling, but I'll use her as an example. She practiced dentistry 4 days a week in her practice. And as I kept looking at numbers, I'm like, we've got all these recall patients that cannot get an appointment. You're literally full. And when they call in, they're booking 5-6 months down the road for their recall appointment, even though they're due right now. This is a problem. And you know what? Your practice is sitting vacant 1 day a week. So let's talk about an associate. And so she incorporated an associate 1 day a week. It's on Fridays. Her practice was closed. She had team members that wanted to work. She was able to do kind of a rotation where they still get some 3-day weekends. And she was able to up her production just by opening the practice. And she was committed. I'm not gonna work that Friday. I'm like, totally get it. Let's do an associate. And it's worked out really well. So even though she's not considering selling, let's say she maintains that for the next 10-15 years, it is a much more robust practice than it would have been without that additional Friday. So thinking about an associate, not only from the immediate relief it provides in what we've just talked about, but also it allows the practice to become ultimately more valuable.
So a couple of things that are micro things, but I'm just going to throw it out there because I'm sure somebody else is thinking it too. Is it worth the headache for, like, so for example, this lady going, I'm not going to work the Friday, but at least the practice is producing more. But at the same time, I'm having a higher overhead because that money's not coming to me and I'm still having to pay the staff to be there and all of that. So what do you say about that?
So it does pay off from a potential buyer standpoint. So yes, buyers are going to look at some of the nitty gritty, but they care more about big picture numbers.
What can the practice do?
Yep.
Okay.
What are they producing? What are they collecting?
Okay.
How many patients do they see on a monthly basis? How much of that is hygiene production? How much of that is treatment production? They look at these big pictures. So when a potential buyer is looking at a practice, they want to look at potential. And normally you can get that by what they're producing, collecting, and then also the number of patients and the productivity per patient is what you're looking at. So when you're thinking, as a practice owner, you're thinking, okay, my goal is to sell in, I don't care if it's 2 years. You can do a lot in 2 years. You want to get production up. You want to get collections up. You want to get the number of patients that you're seeing, what they call active patients. So a potential buyer is looking at how many active patients are in the practice. Some brokers will say that's patients seen within the last 24 months. Some will say that's patients seen in the last 18 months. So that's the range you're looking for. If that number is declining, a potential buyer is going, yeah, the production looks great. Yeah, the collection looks great, but look at this. They're losing patients every month. Or look at this. Now, normally, I'll also tell you, they normally only go back 2 years. So they're not looking at what you did 5 years ago. They're looking at what you've done in the last 2 years. And so they go back and they go, 2 years ago, they saw 500 patients a month. And now look, the production stayed the same, which I guess is good, but they're seeing 425 patients a month. The practice could, if I take it over and there's a chance we'll lose patients, the practice is declining. This is not a good investment for me. Right? So if we can create opportunities to see more patients, to show a steady growing patient base and retention of those patients, and then we have steady production and collections, or even a growing production and collections, those are the numbers I want to look for.
That all makes sense. That's true. And you're right. And an associate can help do that. I know in my practice, I don't want to work more than 3 days in the practice. But as of right now, it feels like I'm in the practice 8 days a week. Like it's just like my brain is always trying to put out a fire. And I vented a lot about that in last week's episode. So, I think that's where it is tempting to sell to somebody else, to say, hey, like maybe if all my energy wasn't going into dealing with this patient issue, this staff issue, all of that, then I could do more dentistry. But then, like we talked about in the last episode, I don't think that that's going to change working for, selling to a corporate. So then if I'm in my own practice, I think what the changes we've seen over the last year in my practice, typically we were kind of 4 days a week, and really maybe even 3.5, because it was Tuesday, Wednesday, Thursday, then Friday we finish at 1. And then now the associate we had a transition. We knew the one was leaving to start his own practice. The other one had kind of come in and slowly picking up more days. And we're kind of watching him. He's watching us, kind of going, what is the opportunity for me here? Do I want to be in this practice more often? When he first started with me, he was only with me 1 day a week, and then in 2 other practices. And then now, as time has gone on, I didn't know where he was going to fall. Like, does he want to pick up more days in mine? Is he going to like the patient base in another practice? There's pros and cons to every demographic, and I didn't know, and he doesn't know, right, what he's going to like and not like. And so as we've evolved now, he's been here with us almost 2 years now, and now he's up to 3 days, and just kind of recently told us, hey, I wouldn't mind dropping this other office. Can you absorb me in this one? And we're like, not right now. And some of the things that I pause and go, well, if I build up my practice to fill up this doc, but then he does ultimately leave, then I'm stuck with this. And then that's where I've got to tell myself, but there's always somebody who wants to come in. Now, is it going to be me who's the limiting factor, that I don't like you, or I don't like this, or I don't like that? So anyway, at where we are as of right now, the bigger issue is, okay, if I'm going to build up and sell, and like you said, but can I accommodate the growth with the staff I have? And that's the other big headache. And right now, nobody can find staff, and myself included. And so it doesn't matter if I've got 2 docs there and I've got all these patients, but if we can't see them, then what are we going to do? So that's what we're trying to figure out right now is, okay, can we manipulate the schedule? And if so, how? How can we manipulate this so that we can grow and see the patients that we need to see? I think, I kind of had an issue about a month or so ago, and I can't remember if I've shared some of it on the podcast or not, but regardless, it was a good eye-opener for me to go, okay, I think we do produce well. I think collections are fine, profitability not so much. And so really looking at that to go, well, where are we getting sucked out here? I certainly think probably overhead is some of that. But now trying to say, okay, so how can we increase the profitability? And you said, well, the good news is you do have the patient base. So it sounds almost like this other doc that has the patients that are trying to get in, but then why are we not getting them in then?
Right.
And so now we're trying to analyze and look at that. Some of the things that maybe we did 3 years ago when we did have a different capacity. And so for example, we put rules in that, the appointments are going to be this long, and we're going to limit the schedule to this, and we're not going to see that there. Well, that worked 3 years ago in the practice, and I don't think we've updated that to the current standing right now. So we're really having to go back and look at our scheduling blocks, for example. And then part of that is, what assistants do we have? And now we're looking at what is my availability and what's the associate's availability. So just kind of looking at all the different pieces. And again, this is like with anything else in the practice, you kind of go along and suddenly you're like, wait, this isn't working. And part of you is like, what just happened here? Like, it was working. Like, where did this break? Why am I reinventing the wheel again? Didn't we just do this? And then it's, for me at least, it's like going, but it is different. The insurances you took 3 years ago are different. The staff you had are different. Like, it's changed. And so it's not like I did anything wrong. It's just, once again, am I a little slow to realize that there are all these changes? Sure. But that's what happens. Like, why would I change something that didn't seem like it needed a change? And then now that I'm like, wait, hold on. The numbers are talking. Mm-hmm. And we can see that. So what are we doing to pivot and change again? Yeah. And I think then that kind of coincides with what we said in the last episode of, when are these peaks and valleys happening? And right now I'm in that, that ditch, that valley, and going, how did this happen? What did I do wrong? What I was working before? Well, things change. Yes. So I didn't do anything wrong. It's just things have evolved, and I haven't quite kept pace with that evolution. In my defense, if 3 months ago, if I was like, hey, let's change this and this, I think I would have been met with a lot of resistance probably from you and the team to go, what are you doing? Right? So I think we're fine. Yeah. Like, hindsight, but I don't think I've been on this trajectory for longer than a couple of months. It's not like it's been like a year and a half that I've stuck my head in the sand. I think, we're watching the numbers, and we're watching the trends, and we're watching the circumstance as it is right now. I do think, and you can tell me more on this, but I feel like previously, generation of your dad, for example, things didn't change as much as they did now.
Right.
And now it's like things are constantly changing. Insurance didn't change this much. Now insurance is changing like every 2 hours.
Yeah.
Staff, my dad asked me the other day, we were talking about, he went to his eye doctor, and he's like, they have staff that's been with them for 20 years. And then we were talking to somebody else who was like, oh yeah, it was his orthopedic doctor that they got the letter that they're closing the practice. The manager that had been a manager for 30 years passed away. The assistant that had been with him, for 28 years is ready to retire. So, And he just said, almost like he was trying to ask me nicely, like, what's wrong with you? Like, why can't you keep a staff? These people, how did they do it? And I'm like, trust me, I've asked that question 1,000 times. Like, how do I keep staff? And I said, I could be making this up off the top of my head, but just looking at it, I said, that orthopedist, if he practiced 30 years ago, look at society 30 years ago. And so when we're thinking about, a female in the 80s who probably had parents in the 60s, that it was she probably saw her mom being the one who kind of role was to say, I'm taking care of the household. And then you come to the 80s, and now you're probably starting to go, oh, well, women are working more, but they still have the mindset of somebody in the 60s because that's what they were. You know what I mean? So I'm like, I don't know if it's this trickle down, but like, you look at my billing person, mm-hmm. She's older, and she worked for, and that's like her work ethic and her mind. It's like, she's just such a different employee than the current ones I have, because she comes from that mindset of, my loyalty is to this doctor, my loyalty is to this practice, and my job is to serve this practice. And that's not the mindset we have today mm-hmm. of employees. And so I'm not saying it's right or wrong. I mean, I know what I think about it, but I'm not going to say that. I'm just saying it's just different.
We can't change it.
Right.
That is, I think, what's really hard about all of this. And I think what's causing so many to reevaluate if they even want to be a practice owner is the stress of the staff. And the stress of the staff is in large part due to that different mindset.
Yeah.
They just view work differently. There is not that long-term loyalty that's not what they value. Ultimately, it's a different mindset that we have to deal with and know that we're not going to change it. It is a generational difference that makes it very hard to manage a practice, but it's part of it.
So then I think about this same generation of dentist owners, but if they think that same way, then are they going to get along better with the staff because they get the staff, or are they never going to be an owner because they don't have that loyalty and they're constantly looking for more, as opposed to the old staff like my billing person, that it's like you're not constantly looking for something.
Right.
This is my career. This is what I'm doing, and I just don't see or hear that anymore. And not to pick on the staff, like myself too. I mean, that's why we're having this podcast. Is this the career I want? Is this what am I going to weather all these storms, or do I just ditch and go do real estate, or go, you know what I mean? Like I go finally open my food truck, like, so it's just like, I'm not picking on the generation, like myself too. Like, I think if I was my dad's generation, it's like, this is my career, my field, and the ups and downs, it doesn't matter. This is who I am. This is my identity. This is what I do. And now we're not tied to that identity, if you will. So it was like me defending myself to my dad, like, I'm not a terrible boss. Maybe I am, I don't know. But I just think it's, the people we're dealing with are different. And so anyway, I don't mean to get off on a tangent, but just back to the associate conversation then, I think, trying to figure out, like, now I've got an associate that wants more time in the practice. I've never had that before.
Right.
And so is that the time to see what we can do to tweak our schedule to accommodate? Can we get there? Do we have the patient base? Do we have the staffing? Could and should we try? Which should we try to adjust first? But in a way, it is kind of like, initially I was like, oh God, one more thing to think about. And the more I think about it, I'm like, this is actually a good thing. This is a good thing. Stop your cribbing for a minute and just think about for a minute and go, you know what? This is an opportunity.
Yeah.
This could be a good thing. So maybe it's the spark, the revitalization I need to get out of this valley and head towards the next peak. I don't know.
Well, and I think sometimes even in the valley where you're like, I hate practice ownership life, part of what can get us out of that valley is actually thinking about, okay, if I am serious about potentially selling, like, let's say in this valley, you've sliced and diced it multiple ways, and you're like, you know what? I think selling is what I really want to actually do. Don't sell right then. Work towards it. Get your house ready. Spend the next 2 years. In my book, you need to spend 2 years actively working on the practice to make sure that it is staged and ready to go for a really great sell.
That is a great analogy.
Yeah. So I think when we do that, it gets us out of this mode of, am I selling? Am I selling today? Well, no, you haven't gotten your house ready. Yeah, you can still think about selling, but start putting the effort in now. Start increasing production. And maybe that's not bringing in an associate. Maybe it is. If the availability is the limiting factor, then you should strongly consider an associate so that you can build those numbers and make the practice look really great. Make sure that you've got good collection measures in place. What are you doing from a patient retention standpoint? And I like to get down into the nitty-gritty of that retention, but a potential buyer is not going to. Is your patient base growing or is it declining? Do you have steady new patients? Maybe you've been sitting at 10 new patients a month and you feel like you're fine with that. Well, if you're losing 20 of your existing patients a month, your practice is in decline. What can you do to get more new patients in your practice? Focus on that for the next 2 years. So sometimes just being able to refocus and go, okay, yes, I am walking towards the sell. I'm going to go that path. Great. It still brings you back to the practice and you figuring out what you can do over these next 2 years to make it the most marketable practice ever, because it is your investment. When we go back to that practice timeline that I was talking about, you've invested all these years, all this time, all this money, all this energy. Capitalize on your investment and get your practice ready to sell for the next, even if you're like, I want to sell today. Okay, great. I get that. But for the next 2 years, focus on getting your practice ready.
So, I mean, and that's super smart. And especially like stepping back and looking at it from that vantage point. I think what a lot of us think, because I've seen a couple of people do it, and I think a lot of us are like, I can't do this anymore. It hadn't even occurred to me to try to build up my practice because all these DSOs are knocking at my door and saying, sell, we'll buy your practice. And so I think in my mind, I'm thinking, well, if you're offering me all this now, like, let me get out of here. And what I'm hearing you say is, if you're going to sell, but regardless of whatever they're offering you, you could get a lot more. So it's like you said, it's like selling the house. If I didn't do one thing to paint my house or fix one thing, somebody might come buy it. Okay, so that's going to be the question I have for you. Like, it depends on the market and all of that. But, there was a time here, about a year ago, that it didn't matter. Like, people were over offering more than what the house was worth. So at that point, it wasn't worth it for me to invest in my house to do one thing because somebody was going to buy it.
Yeah.
I guess that's the thing we're weighing out right now that people need to think about is, Are you truly like anybody's going to buy your practice? Doesn't matter what you do, your practice, you're still going to get top dollar because somebody wants it that bad?
I think that's a dangerous assumption.
Right. And that's what I was about to say. I think that is, are you sure about that?
That's correct. I think if we assume that, we have the risk of losing in that whole equation. I would much rather assume it's going to be a market where I need my practice to look good. Because even from a DSO standpoint, they want to make a smart investment. And if they look at a practice and they go, oh, wow, they're missing a lot of opportunity. We could turn this around overnight and make this so much more successful. What they're going to do is they're going to offer you, there's usually a percentage range of your total collections that they'll offer you. They're going to offer you the lower end of that because in their mind, they're going to have to do some work to get an investment out of that. You've got one that's firing on all cylinders. They're going to have to offer competitively because they know they're up against potentially other DSOs or even private buyers. So anytime you get into, again, I think it's easiest to equate it to real estate. If we get into a multiple offer situation, right, then we're looking at, wow, I can get more than what I thought I might get out of my practice. The same thing is true with your dental practice. If you've got multiple DSOs, when they look at those numbers, they're like, wow, that's amazing. I want that practice. That's a great, solid investment. Then you've got the chance of actually earning more out of your practice than you would.
So it's funny, I'm thinking about this colleague now, and he's an oral surgeon in a small town in Texas. And I see him every few months. And I think it's been almost a year now where he was telling me that he is talking to a DSO because the way oral surgery is going, and now it's getting harder and harder to, I mean, all the same things, I guess, that all of us are going through, but maybe it's more prominent in oral surgery, or maybe that's how he views it because he's an oral surgeon. But regardless, like, I think he's saying, like, you know, it's getting harder and harder to find sole practitioners. People are going to these DSOs, and everything his buddies have told him that have done the same thing, that it's not as terrible as he had thought, and blah, 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 like all of this same conversation, and how it's hard to recruit an associate because these DSOs can offer a better package, and same with staffing and all that. So he just never seemed the type to me who would consider, you know, selling to a DSO. He just seems like he's very methodical and wants things a certain way. And I was like, you don't seem like the type who's going to give up control.
Yeah.
And so anyway, you know, see him every few months. And so say I saw him in April, and then 3 months later, hey man, how's it going? Like, did you make anything? He's like, well, you know, there's still negotiations, whatever. See him 3 months later. He's like, yeah, I thought my practice was in a good spot, but because there has been some decline in the last 2 years, albeit it's because of COVID, like very justifiable, but there's still a decline. And I'm thinking, you're in this small town, you're one of the few oral surgeons in this town. I can't imagine what you produce in a year. And yet this DSO is telling you that you're not quite there yet. And I bet you anything, now that you're saying it, I bet you anything. Because I've asked him before, I was like, why wouldn't you bring an associate in? Or why wouldn't you, whatever. And it's the same old thing. So I haven't really been able to find one in this small town. It's hard to recruit somebody. Then the minute you try to recruit a DSO, we'll offer them something more. So he's like, well, I haven't really been able to. Now that you're saying that, that's probably what they're looking at, going, I'm not going to invest in this because this could yield so much more. So they've kind of lowballed him, and he stepped away from it then.
Yeah. Yep.
That's probably what's going on there. And I was just shocked. I was like, what do you mean? Like he's like, well, they came down on their offer once they saw that the practice was kind of like, it's not doing bad. It's not like it's losing money.
But there's a decline. It's an investment. They are viewing it strictly as an investment. And there is more risk if they put their money into a practice that is showing active decline. And therefore, they should pay less for it.
And I guess in his mind, he's not declining. He's still making more money. He made more money this year than last year. But that's multifactorial. And at the end of the day, if you're just looking at it, like you're saying, from a numbers perspective and those key performance indicator kind of things, you know, if we're having to tell a story and go, well, it's because of, then they don't want to know that. It's just, what do the numbers show? The numbers are going to tell a story, and that's that.
Yep.
So, yeah, very interesting. Okay,
Yeah.
so back to we were supposed to be talking about associates. Are we?
I think
did I get off track here?
No, that's okay. Exactly where I wanted it to go, because I think when we can think about putting on that mindset of, I'm going to sell my practice, and maybe it's not even in 2 years, right? So maybe we're like, hey, I know eventually I'm going to sell. I might have a longer timeline. I might have 10 years. My big challenge to a lot of people is, can you at least think about that 10-year mark and let's run the practice in a way where it looks good in 10 years. And so the associate can be, I think, any practice owner that is looking to having this moment of, I want to sell, I'm really thinking seriously about it. Can your practice stand to go up? If you had more provider availability, could you produce more out of the practice? Could you collect more? Could you see more patients? If the answer is yes to that, and that's not yes in every market, so I want to be really clear about that. There are certain markets where it's like, I know I'm scraping the barrel just to get the patients in that I get in every month. Absolutely, an associate is not for you. We do not need to think about that.
Do you want to talk more about that? Like financially, can you afford an associate, or do you want to save that for another?
I think let's save that. In all honesty, financially, I feel like there's a lot of things that any practice owner can do to afford an associate if the patient base is there. So to me, it all comes back to the patient base or the potential patient base that we're not tapping into. And if we've got enough patients to sustain an additional provider, then we should absolutely consider that. If we don't, then we need to get prepared for that.
So, for example, like I'm in the DFW area, and there's like 4 dentists at every corner. Mm-hmm. So, and I thank God that I'm a specialist, that we still draw because we have a niche, and I don't know how General does it with 4 on every corner. So what are just some, without getting into details, because I know each one separately could be an episode unto itself, but are we talking about how do you build that patient base in terms of, do you have a niche service you offer? Do you do more marketing? Mm-hmm. Are you the one that's open evenings and weekends? Is that what you're talking about? Like how, or what are you?
So I like to actually start bigger picture first. So the first question is, from a retention standpoint, do we have a lot of patients in the practice that are due but have not been seen? That's your first, because that's the cheapest thing you can do, is to try to reactivate those patients. So you start there and go, how many do we have? Kind of, I call them in a bucket. You've got patients in a bucket. Some of them you've pulled out and you put on the schedule, but how many do you have left in the bucket after your schedule's filled each month? So that's the starting place. New patients is obviously right after that. Let me say one other thing on the patients in the bucket. Not only is it through your hygiene program, and we've talked about this a lot in your practice, but the patients that need treatment, are we then able to convert them and get them to stay on the schedule? Because we all know that hygiene doesn't pay the bills. It is ultimately the wheelhouse for where we get patients into treatment, which is where we actually make the money. So are we getting patients into recall is the first question. And recall, I mean, you look at ortho. Ortho has recall too, right? How many patients have we seen, and how many patients need to come back and stay retained in our practice? So recall is a lot bigger than just hygiene appointments. But for the sake of this example, how many do we have in hygiene? How many are due for hygiene that ultimately we're not seeing, either because we don't have space or we haven't pursued them? Then the second component to that is those that are needing treatment, are they pursuing treatment or not? And if not, why? We need to fix that problem. So start within your own house. Then you go to new patients after that. Again, it varies based on the specialty, how many new patients you should be seeing. It's based on how many patients you're losing each month. If we're losing 20 each month, then we at least need 30 to show that the practice is growing in patient numbers. So figure out, what are we doing from a marketing standpoint? What could we be doing differently? I have found that most times, I would say, I'm going to go high, 95% of the time, it is due to lack of marketing initiative for the lack of new patients. So I never step into a practice and they're low in new patients and they're like, we're doing this and we're doing this and we're doing this and we're doing this. And I'm like, oh, that's a good comprehensive marketing package. Wow, that's really good. I don't know why the new patients are there. It's never that. It's normally like our new patients continue to kind of dip. And I'm like, well, what are we doing from a marketing standpoint? Well, we've got a referral price, Okay. And what else? Well, that's about it. okay, we've got a lot of opportunity to really get new patients. So we have to work for new patients in one way or another. So I think that's the second component. Once we've tapped all three of those, recall retention, treatment retention, increasing new patients, in all honesty, that solves most of the problems. But then if we're still not solving problems at that point, we go, okay, what else do we need to do to be competitive? Is that an additional product we need to offer? Is that nobody in our town works on Friday and now we're going to be open on Friday? What else can we do? But to me, that should be the last resort. We should look at all the other things first.
So again, connecting this back to, because these conversations could go a lot of different ways, but the point of keeping it tied with the associate is, can you afford an associate? And this is where we go back and it boils down to what is the potential to see patients.
Yep.
And so this is the way we're talking about to make sure that you've got enough patients. And if you're not in a position to where you could hire an associate right now because of financial, is there enough dentistry to be done, then this is where we start.
That's right. Start there. Most of the time there's capacity there, but we don't have enough provider time to be able to meet that capacity. And that's where an associate comes in. And to tie it all the way back to, should I sell my practice? That's what gears your practice towards being very marketable if and when you decide to sell. All right. Thanks for chatting with me about it.
I only have like 1,000 more questions.
Stay tuned for more questions.
Thanks for joining the conversation today. We hope that you are comforted in knowing that you are not alone, but we also hope that you're walking away with some really great tips and tricks to try in your practice. We value your feedback, so please take a few moments to rate and review the podcast. Finally, we want to make sure that we're covering the topics that matter to you. So track us down on Facebook, Instagram, and Twitter, and let us know what topics you want us to cover. As always, please know that we are rooting for you today as you manage your dental drama.